Hi, my name is Mitchell Yass. Welcome to my downloadable content page. The purpose of this page is to provide you with an opportunity to experience my method of understanding what causes pain and how to resolve it. Each downloadable is created for a specific diagnosis. Since most people leave their physician with a diagnosis to explain their symptoms, I felt compelled to provide lectures to explain in layman's terms what the diagnosis means and whether or not it's valid. I explain my rationale for what is actually causing the symptoms. In 90 to 95% of all patients I have treated, I have established that the cause of pain is muscle weakness or imbalance and not the typical causes being described by the diagnosis given. Even when pain is experienced in a joint, the cause was found to be a muscle weakness or imbalance, resulting in a misalignment of the joint surfaces, creating increased joint surface rubbing, leading to irritation and pain at the joint. With this in mind, the only remedy for resolving the pain was strength training. Each downloadable not only provides the rationale for why the cause of pain is most likely not from the structural abnormality described as the diagnosis, I explain why the cause is most likely due to a muscle weakness or imbalance. I then demonstrate and explain the most appropriate exercises to resolve your pain. My goal is to provide an alternative point of view based on logical theory and my extensive clinical experience. The existing system is failing because there is an obvious lack of ability to identify the cause of pain and treat it. Masking symptoms with medication or providing unnecessary surgeries do nothing to resolve the cause of pain. They only prolong your pain and suffering. Please take the time to examine my approach to what is causing pain and how to resolve it. Thousands have benefited from my method. Today is your day to overpower your pain.
Back pain, why surgery doesn't always work, and how you can get relief without going under the knife. That's coming up next on Long Island Naturally. Hi, welcome to Long Island Naturally. I'm Mary Musi. A good orthopedist will tell you the agonizing truth. Surgery is not a sure bet for getting rid of back pain. But he might not tell you just what the odds really are. In fact, nearly 30% of surgical patients don't get relief. So if you're considering back surgery, you might want to hear what my next guest has to say. Physical therapist Yass is the author of Overpower Pain, the strength training program that stops pain without drugs or surgery. Every year, 300,000 people have back surgery. Unfortunately, 80,000 say their surgery failed to relieve their pain. Now there's evidence why. According to an editorial in the British Journal of Medical Practitioners, there's no clear correlation between pain and some of the physical problems that back surgery is supposed to correct, such as degenerative disc disease. Yet MRIs show bad discs are often used as evidence that people need surgery. So before you go under the knife, you might want to consider this. The body heals itself when given the right support. And for back pain, the right support may just be exercise. My guest is Yass, a physical therapist and the author of Overpower Pain, the strength training program that stops pain without drugs or surgery. Also joining us are three of his current patients who all say their surgery failed to relieve their pain. They are Susan Helsinger, Sherry Banks, and Lauren Canton-Finger. Thank you all so much for coming. Susan, let me start with you. You had totaled eight spinal fusions, and you had problems sleeping afterwards, and somehow you found your way to Mitch. Tell me, what was he able to do for you, and has your sleep problem improved?
Yes, I actually saw, I was desperate one evening and I was watching your television show, and Mitch was on the show, and he talked about helping people with acute back problems. My problem is skeletal as opposed to, I don't have a disc problem, and I was in extreme pain, and I emailed Mitch that night because you put up his website, and the next morning I received a phone call from him, and I went in, and it really was tremendous help. By the second time I realized that this is where I belonged.
Has your sleep problem improved? You said you hadn't slept for months.
Yes. Well, the acute pain was just keeping me up. I couldn't find a way to sit or lie. What happened is the orthopedist felt maybe I should do more exercise. So I was walking and I was doing a lot of exercise, which were counterproductive for me. And then I really had walked myself right into terrible pain problems. And Mitch relieved me almost immediately.
Okay, now Mitch, a big part of your program is exercise. So how is it that Susan was exercising and making herself worse, and yet when she went to see you, you put her on an exercise program?
Well, she makes a very valid point that not all exercise can be considered to be effective. All exercise should be considered purposeful, meaning that an evaluation needs to take place, and in understanding what's causing the person's symptoms, we can create a program that's specific to that person's needs. So where she tried to incorporate a type of walking or a treadmill or something of that nature, she really needed very specific strengthening of particular muscles, which is what we focused on, which gave her a fairly immediate result.
Yes.
So Susan, how long did it take before you felt a result? And did it surprise you that exercise turned out to be the answer?
Very interesting, because to me, I am very protective of my spine and my body, having been through in the hospital 60, 70 times. So when I went to see Mitch, I was very careful with what he was going to do, and he said, don't worry, and he actually manipulated me in a certain manner, and after 2 times to see him, I slept. I couldn't believe, and I was able to concentrate on on work and what I was doing, and then I wouldn't miss an appointment, because it's wonderful to have a safe place to know I can go somewhere. He gave me different kinds, not walking, but different physical exercises to strengthen myself that really has helped.
Okay, and Sherry, you also were put on an exercise program, right?
Yes.
Had you been exercising before? Was that a factor in your...
You had been
to previous physical therapist, correct?
Yes, I had been exercising, and my physical therapist previous to that had me doing different exercises than Mitch has me doing now.
So what is your understanding of what happened and how some exercises were helpful while others were not?
Well, my old physical therapists were all treating my back and my core, and Mitch is treating my legs and my hips. So he has a totally different approach on what is the problem and what is wrong with me.
Mm-hmm. And how long have you been going?
I've been going to Mitch for 2.5 months.
Okay, and any results so far?
Yes, I feel 50% better than I did before I came, and I can actually get up in the morning and I can get out of bed, where before my body felt like it was twisted. I was in a pretzel and I couldn't get out of bed.
Okay. And Lauren, you also everyone here had back surgery. You had back surgery as well. In fact, you had 2.
I did.
You said the first one helped somewhat, but then the second one was a disappointment, right?
The second one, after the second one, I had extreme weakness in my right leg, and I had severe back pain in my lower back, and I also had a lot of pain going down the left leg as well, and sciatica. Okay,
and how did you find, and what condition did you walk into Mitch's office with?
When I walked in, I could barely walk. I mean, I was walking, which is, I'm thankful for, but it was very hard. I didn't feel comfortable walking. I couldn't walk from here to there. It was very hard for me.
Okay, and does Mitch, what does he do? He puts you on physical therapy as well?
I am. I go to physical therapy 2 to 3 times a week. They're very, very intense physical therapy sessions. I'm there 2 to 2.5 hours. Basically, we do like a weight training, doing weights. Every week when I go, I get stronger. The first time I went, I did 1 pound. Now I'm up to about 7 pounds. His approach is very different. I like it. It concentrates on certain aspects that other places I haven't gone. They do that here.